Hello everyone, I am Dr. Sandeepan Haldar, consultant nephrologist. I am from Kolkata, the eastern part of our country. Today the topic of discussion is edema. Pedal edema is very common symptoms which can occur in a variety of diseases. So whenever there is swelling in the legs, people come to the doctors. These are some basic ideas which I want to give today through this video. Pedal edema, first patients must notice whether it is a unilateral edema or a bilateral edema. If it is a unilateral edema, then local causes are responsible like trauma, any infection in the limbs, any disease in the venous system of that particular limb, or if there is a problem in the lymphatics like filaria. So these all can lead to unilateral pedal swelling. And if it is a bilateral swelling, then people can suffer from heart failure, heart disease, people can suffer from kidney disease, people can suffer from liver disease. Also there are some drugs like painkillers which we often consume. These painkillers are also a cause of bilateral pedal edema. Also in young age group females, they take oral contraceptive pills that also can give rise to this pedal edema. Another thing which one should notice, if it is a pitting edema or a non-pitting edema. If it is a non-pitting edema, most commonly hypothyroid is the cause. Thyroid hormones levels, when they are subnormal, it can lead to a non-pitting type of pedal edema. So hypothyroidism is a cause of non-pitting pedal edema. So now when a patient comes to us with bilateral pedal edema, we have to take a few points in the history, such as if the patient is breathless on exertion, if the patient can lie down comfortably in his bed. So whenever patient is having a breathlessness during exertion, or if the patient is having dyspnea while lying on the bed, we suspect if there is a cardiac disease or not. So ECG, echocardiography, NT-proBNP, these tests should be done to discover the cause of any cardiac edema. Also, we have inquired the patient about the history of alcoholism. If the patient is having a long-standing diabetes or patient is alcoholic, these patients can turn up to a decompensated liver disease, which can give rise to pedal edema. Also, these patients should notice if there is a swelling in the abdomen also, because this liver disease, there will be edema in the legs as well as there will be fluid in the abdomen. So these people should also notice if there is swelling of the abdomen or not. In renal edema, there is accompaniment with anemia. Patient also complained of froth in the urine. In some rare cases, there might be evidence of blood in the urine. So these are in renal edema. Most likely patients come with a history of high blood pressure. So these are the things we should inquire or check if the patient is having a renal edema. We should do a urine examination. We should do a urea creatinine. We should do a complete blood count. We should do a ultrasound of the abdomen. So these are the three main causes where patients suffer from pedal edema. If patient is having a bilateral pedal edema, what patients can do at home? Patients should limit their fluid intake. Patients should avoid extra salt in their diet. And after this, patients should turn up to the doctor. We use different types of diuretics which act in different parts of our nephron to drive out the extra fluid. So first of all, we have the loop diuretics, the earlier generation furosemide, and in the current generation we have prostaglandin. Prostaglandin is more potent than furosemide in driving out this extra fluid. So we generally use these drugs to drive out the excess fluid. Also we have thiazide diuretics and also we have clothianidol. these two diuretics are also there which act further down in the loop of further down the loop of Henle. So these diuretics can be combined to have an additive effect of diuresis. Also, we have some potassium sparing diuretics which act in the collecting duct like spironolactone and eplerenone, which can also be added if there is refractory edema. So these in short are the explanation of the symptoms of edema, the possible causes and how we manage, and that needs to be diagnosed by a physician so that the patient gets relief from this excess fluid in his or her body. Thank you.